section, you're going to have the chance to observe some very basic calls with cases and contacts, so you can see how this all works together. In this video, you're going to see a really basic example of a call with a case. Now, this is a case where nothing goes wrong, where they have very few contacts, and they're very agreeable and able to isolate as you instruct. So let's see how this works.
Hello, may I please speak with Larry Murray?
This is Larry. Who is this?
Hi, my name is Amy Jones from the Hillside Health Department. I'm calling to follow up on the lab test you had done last Monday. Is now a good time for you?
Yeah, that. Sure, why not?
Thanks, Larry. Before we keep talking, I need to confirm your date of birth. I have here that you were born in 1947. Would you be willing to confirm the day and month?
October 25th.
Okay, and our records list here that you're living in Hillside on Gale Drive. Could you please confirm the full address?
Yeah, that's 510 Gale Drive.
Perfect, thanks. All right, well, I'm calling today about your COVID-19 test. Has your physician already called you to talk about the result?
Yes, I was positive. I have coronavirus. They said you might be calling.
Yeah, well, we're getting in touch with everyone who has coronavirus. We just want to check in on you, review what your doctor said, and ask a few follow-up questions. We're just hoping to make sure that you and our community stay safe.
I understand.
Okay, so this should take about 10 to 15 minutes, and if at any point you need to take a break for that cough, you just let me know. That okay?
Yeah, sounds good. It's enough time before my show.
Right. Don't want you to miss that. And if there's anything that you don't understand, you have questions about, or you need me to repeat, please just let me know. We want to make sure that everything is clear. Got it?
Okay.
Okay. Oh, and also I should mention that everything we talk about today is going to be between you and me. So we won't share your personal details outside the health department.
Sounds good. Thanks.
Okay. Well, to start off with, how are you feeling today?
Well, everything still hurts. And I get tired whenever I walk to the kitchen from the living room. I mostly live on the couch.
I'm sorry to hear that. When did all this start happening?
I think it was last Monday. Yeah, one Monday. I just didn't feel like myself. I got a bad fever. I just felt achy.
Yeah, So any shortness of breath while you're trying to move around?
Yeah, but mostly I just don't feel great. Like I cough whenever I try to do anything.
Yeah, you're really not feeling good.
Yeah, and I told my cousin that I wasn't feeling well that day, and she said I ought to call my doctor right away.
Okay, so all of this was happening this past Monday, the 20th, and now it's Wednesday. Yeah. Okay, so you're really right there in the thick of it right now. Does it seem like your symptoms are getting worse?
No, pretty much the same, honestly. My fever's going down a bit, but I had a bout of diarrhea yesterday. I'm just really tired.
Yeah, I can only imagine. Have you been taking your temperature?
Yeah, the doc told me to do that. So.
Okay. Well, do you know what your highest temperature was, like on your worst day?
Yeah, it got up to 102.3.
Yikes, that is hot. And what's your temperature today?
Today it's just 100 degrees exactly.
Okay, so 100 degrees exactly today, but high, but getting lower. And it sounds like you're tired, but are you staying in good spirits?
I'm trying to.
Yeah, I've heard that it can be really difficult. Yeah. So if I've got this right, since you started feeling sick on Monday, you've been very tired, you've been sore, you have some fever, headache, cough and some diarrhea. Is there anything else?
No, that about sums it up.
And how about your stomach today? How's it feeling?
Better than it was, and I can eat today.
Oh, I'm really glad to hear that. So there's a few more symptoms that I'd like to review with you today. They're pretty common. Would you be willing to let me know if you've experienced any of these since you've been sick?
Sure. What do you got?
Okay. Any chills with your fever?
No.
Okay, no chills. And what about vomiting?
No.
Okay. And with that cough, has your throat been sore at all?
It was pretty sore on Monday, but it's better now. When I cough, it kind of hurts.
Yeah, I can imagine. I'm sorry to hear that. Could you tell me a little bit more about that cough?
Well, if I do anything, I start to cough. But to be honest, I don't really want to do much. If I'm just lying in bed, bed or on the couch, though, my cough isn't too bad.
So when you get off the couch and you go to eat or do whatever you need to do in the house, do you feel short of breath then?
I feel more tired than short of breath. I can fix my food and talk on the phone, but I sure couldn't run a marathon.
All right. So you're not feeling great, but definitely better than Monday, it sounds like. So over the next week or so, if you could just keep track of how you're feeling and let us know if you do start to feel worse or if things just don't seem to be getting better at all.
Sounds good. Will do.
Okay. And if you ever do start feeling like very short of breath, we recommend that you call your doctor, okay?
Got it.
Okay. All right. So let's move on to this next section here and talk a little bit about how coronavirus spreads. What we know is that about 2 days before you start feeling sick, you can pass it on to other people.
Really? That's terrible.
Yeah. So since you started to feel sick on Monday, it's possible that if you were around anyone this past weekend, they could possibly also get coronavirus.
Oh, no. I went to choir practice on Saturday.
Got it. Okay. So.
Does that mean that, oh, no. Jeez. Can't believe that.
Larry, I hear you worrying over there.
Yeah, I just don't want anyone else to get this. It's not fun,
Yeah, I hear you.
Well, I guess it's lucky it was just me and a few other folks there this past Saturday.
Yeah, you're worried about your friends, and it's good to hear that there's only a couple folks there. So let's take it step by step and talk through everyone that was there.
Are you going to call them?
Yeah. It's the health department's responsibility to get in touch with folks who've been around people with coronavirus. It's good for them to know and to pay attention to how they're feeling.
Right.
Yeah, and like I mentioned, I'm needing to make sure that you, your friends, our community stay safe. And right now, there's a possibility that they could have coronavirus and not know. If we can reach them and they're able to stay home, then we can stop it from spreading further.
Yeah, I guess.
Yeah. Okay. Would you be willing to work with me to list out everyone was there so we can keep folks safe? And you're free to call them first before we reach out.
Yeah. Geez, this is a mess. Really a mess.
Yeah.
Okay, look, let's do this.
Thank you, Larry. This is really important stuff. Okay. Let's start with who was singing next to you. What's their name?
Oh, wow. That'd be Annette.
Okay, Annette. And last name for her?
Peterson. It's Annette Peterson.
Okay. And do you have a phone number for Annette?
Oh, yeah, we're good pals. Let me get that for you. Wait a second.
Thanks.
That'd be 646-123-4567.
All right, 4567. Got it. All right, and since you're good pals, do you happen to know her birthday?
February 7th, I'm pretty sure.
Okay.
Not sure about the year.
That's okay. And who was singing next to Annette? All right, excellent. So now we have the 5 folks that you were at choir practice with on Saturday. And did you do anything else on Saturday? Did you go out to eat after?
No, I just came home and I mowed the lawn.
Yeah, last Saturday was really beautiful out. I'm glad you had a chance to be outside.
Me too. It was great.
Okay, so what about Sunday? Did you do much on Sunday?
No, I was at home all day Sunday because I had worked a ton on Thursday, lifting a bunch of boxes. So besides choir practice, I just sat at home on Friday, Saturday, and Sunday, and I relaxed in the house.
All right, so just Saturday, Sunday, relaxing in the house. And did anyone come over?
No, it was just me.
Okay, no neighbors, no friends.
No, I live pretty far out of town. Nearest neighbor's about a half a mile. So I just watched some old favorites.
Yeah, I hear you. So to summarize, you had choir on Saturday, watched TV on Sunday, and then you started feeling ill on Monday. And did you go to work on Monday?
No, I'm part-time, so I called my doc in the afternoon, like my cousin said. The doctor told me to go to a drive-through testing site and then call in sick to work.
Oh, okay. Well, that was quick.
Yeah, I'm lucky my boss was so understanding.
Yeah, that's a relief. Did you drive there with anyone else?
No, it's just me in the truck.
All right. So since you got tested, have you driven anywhere else, like gone to the grocery store or gone to visit family or friends?
No, I've been sitting tight. I got a garden and a few chickens, so I'm fed.
Fantastic. Well, then, besides your choir practice, it sounds like you weren't in close contact with anyone else. So, thanks so much for sharing that.
Yeah, no problem.
Okay, Larry, we're just about wrapped up here, but this next part is really important. So because you tested positive for coronavirus, we're officially requesting that you agree to be isolated until we clear you. So what being isolated means is just that you should remain in a space like your house by yourself and not leave it, except if you need medical care. For example, if you start to feel worse, if you break a leg, anything like that. Yeah, me too. You already got a lot on your plate.
Yeah.
So, yeah, basically this just means no work, no grocery stores, no pharmacies, no visiting friends or family, no friends and family visiting you, and no choir practice. And we'll be following up to make sure that you're doing okay.
Well, let me ask you, how long do you think I'll have to take off from work?
Yeah, well, it depends. But it's really just a matter of your symptoms improving and your fever going away. And if those two things happen, then there won't be as much virus in your system. And with less virus in the system, then you'll be less likely to pass it on to others. But honestly, I can't be that specific right now because we just have to wait and see how you're feeling. It can be 8 days, 10 days, maybe more. It's just hard to say.
Okay, well, I guess that makes sense.
Yeah. So is there any of this isolation stuff that we've been talking about that you foresee being a challenge for you?
I don't think so. Like I said, I'm pretty set here.
Okay. So just a few more follow-up questions, and we're getting close to the end, and I just want to make sure that we're in agreement. Okay?
All right, sure.
Okay. So if you need groceries, how will you get those?
Well, let's see. I bet my cousin will leave them on my doorstep.
Perfect. Yes. Okay. And next, I just want to remind you about some of the concerning symptoms out there for coronavirus. If you start to feel short of breath, if you start to feel confused, if you get a chest pain that keeps going, or you notice any blueness in your lips or in your face, we request that you would get immediate medical attention. Coronavirus can make people pretty sick, and I don't want you to hesitate. So you can call your doctor or even 911 if any of that happens, okay?
Yeah. Hope I don't need to, though.
Yeah, I hope so too. But if you were to need to, you'll need to tell your doctor or tell 911, whoever you call, that you tested positive for coronavirus, and that way they'll be prepared for you.
Got it. So I should call ahead.
Yeah. And if you go out anywhere, like if you do need to go to the hospital or the doctor, you're going to need a mask. So do you have one of those lying around?
No, but I have a bandana. Will that work?
Yeah, that'll be fine. Just be sure to double it up real good, okay?
Yeah, for sure.
Okay. And will you be needing any medications? Do you have a doctor appointment in the near future?
No, I'm really healthy. Besides the coronavirus thing.
Yeah. Well, it sounds like you're sticking with it. All right. Larry, those are all the questions that I have for you today. Thanks so much for going through all that with me. I know it was a lot to talk about.
Yeah, but it's important. I just hope everyone's okay.
Yeah, I admire how much you're hoping everyone's okay and that you care about your friends.
I can't help myself.
It's nice. So, well, I got to ask you a bunch of questions. What questions do you have for me?
Honestly, I asked my doctor all about it, so I think I'm good.
Okay. Well, either me or one of my colleagues are going to be calling you later to check up on that fever. And until then, please stay isolated like we talked about. And I hope you feel better real soon.
Yeah, thanks a lot.
See you, Larry.
Bye. Take care.
Now you're going to listen to a very basic call with a contact. And again, this is a very simple scenario where the contact doesn't have any symptoms and where they're happy to quarantine themselves and have the resources to do so. So let's watch this video.
Hello, is this Annette Peterson?
Yes.
Hi, Annette. My name is Drew Evans with the Hillside Health Department. How are you feeling today?
Good, thanks. What's this about, please?
Well, I need to discuss some personal health information with you, so before we go any further, I just want to make sure I'm talking to the right person. I have listed here that you were born in 1958 and that you're living on Pebblebrook Circle in Hillside.
Yeah, that's right.
Could you confirm the day and month of your birthday?
Sure, it's August 4th.
Great, and your full street address?
1994 Pebblebrook.
All right, thank you. So, Annette, I am calling to let you know that last Saturday you came in close contact with a person who tested positive for COVID-19.
Oh my God, are you sure?
Yes, we have strong reasons.
No. Oh, Jesus, this can't be happening.
I'm sorry, Annette. I know that this is surprising. I'm here to help you and to understand what it means, offer you some guidance, explain a little bit about what you can do and how you can protect the people around you.
Okay. Yeah, well, sure. Yeah, I guess that's okay.
This should take about 10 or 15 minutes. Would that be all right?
Yeah, that's fine.
Thanks. If there's anything you don't understand or you need me to repeat, please let me know. I want to make sure everything is clear. And before we hang up today, I'll make sure you have a phone number to call if you have any questions.
Okay. So, how do we start?
So, as I mentioned, we have reliable information that you were physically nearby someone with the coronavirus for an extended period of time last Saturday.
I mean, I just went to choir. choir practice on Saturday. Was there somebody there who was sick?
Unfortunately, I can't give you any information about the person who tested positive, but they did provide your name.
Oh, God. So does this mean that we're all going to get sick?
There is a possibility that you may get sick. Obviously, we hope that this doesn't happen, but why we're calling you today is to see how you're doing, to give you some instructions, and to help you make a plan, okay?
Okay. This is not how I expected to start my morning.
But I can imagine, and I'm sorry to deliver this news so early in the day.
It's all right. I mean, we're going to make it work.
Thanks, Annette. So let's get started. How are you feeling today?
I mean, I'm tired a bit, but I think it's just stress from work. Otherwise, I'm fine.
Yeah, work can be tough. I hear you. Let's see. So I know that you said you were generally feeling okay, but I need to ask you about a few specific symptoms.
All right.
Since Saturday, have you felt short of breath?
No.
Do you have a cough?
No.
Any fever?
I mean, I don't think so.
Okay. Do you have a thermometer at home?
Yeah, but I haven't taken my temperature. I feel fine.
That's fine. We may recommend that you take your temperature regularly to see if there are any changes over the next few days, but we can talk about that later.
Okay.
All right, so no shortness of breath, no cough, no fever, anything else besides feeling a little tired from work?
No, I'm really pretty healthy. I cycle. I take the dog out about 100 times a day.
It sounds like you're very busy with that.
Yeah. You know.
Okay, so since you were nearby someone with the coronavirus, like we talked about earlier, you might have also become sick.
Right, but hopefully not.
Absolutely. We hope you don't get sick, but if you were, it will likely happen sometime in the last 14 days after this past Saturday. About half the people who get sick will start to feel bad in about 5 days after catching it, but nearly everyone who gets sick from the coronavirus will have some sort of symptom within 2 weeks.
Okay, so I just have to wait it out.
That's exactly right. But the tricky part is that people can pass the virus on about 2 days before they even start to feel sick.
Oh, jeez.
Yeah, it's wild, right? So since you were around someone who tested positive and there's a possibility that you're positive too, we strongly recommend that you quarantine yourself.
So I'm just back to staying at home alone without going anywhere?
Yeah, that's right.
Right.
All right, so basically what quarantine looks like is that you should stay away from others entirely and watch for any symptoms. And when I say symptoms, I just mean headaches that don't go away, a cough, a fever, or just feeling unusually tired for a bit, or anything else.
But so how long do I have to do this for?
Well, if you're around the person with the coronavirus on Saturday the 10th, that means you should be quarantined for 2 weeks after that date. So not this Saturday, but the next one. So that would be the 24th.
Right.
Yeah, I hear you. We're asking that everyone with the coronavirus and people like you who've been around those folks to stay at home. That means no grocery stores, no visiting with friends, and no work. What challenges will this cause for you?
I mean, I don't have much food in the house, and my boss is not going to be really happy. So.
Okay. So it sounds like your boss might be disappointed.
Yeah, I mean, I guess I can do a lot from home. It's just, it's easier to do it at the office. You're sure that this is all necessary, though?
I hear you. We're making a big ask, but we're hoping that this will help protect your community and cut off spread to even more people. Breaking the chain, if that makes sense.
Yeah, I guess so. I'm gonna make it work. It'll just take some effort,
Definitely. So let's make sure that we're in agreement about your quarantine, okay? What's your living situation like?
Well, I live with my dog, and I have a renter in the apartment downstairs.
Okay, a renter. Do you share any common spaces with your renter?
No, she's got her own entrance and stairs. She doesn't need to come in here.
Great. And I heard you say that you don't have much food at home. Is that right?
Yeah, I didn't go to the store this week. I wasn't planning for this.
Right. Is there someone who could help you, or can you get delivery?
Well, I guess I could call my daughter. I mean, that could work.
Okay, so your daughter's nearby?
Yeah, she's around the corner.
Yeah, that's lucky.
Yeah, I love having her around, so.
Okay, so your daughter will be bringing you groceries.
Well, can she come in the house, though?
We wouldn't recommend that. It would be best if she could just leave the groceries at your door, and for the two of you to stay at least 6 feet away from one another. So preferably she would stay outside.
Okay, I mean, that makes sense.
Do you have any medications that you need to refill soon?
Yeah, but I could get the pharmacy to deliver.
Okay, awesome. Do you have a doctor?
Yeah, Dr. Jones over at the Ashland Clinic.
Excellent. So if at any point you start to feel sick, you need to call Dr. Jones's office and let them know that you're not feeling well, and that we called you to say that you had been nearby a person who tested positive for the coronavirus. It is important that you mention this, so if you do go in, they can take the necessary precautions, and they can determine whether you should be tested for coronavirus too. Does that sound good?
Yeah, that sounds good.
Okay. Same thing if you need to go to the emergency room, just make sure you call ahead and mention that we informed you about being in close contact with someone who tested positive for the coronavirus. Do you know which hospital is closest to you?
Yeah, Mercy Hospital. It's like 20 minutes drive.
Okay, perfect. And do you have a private car?
Yeah.
That's awesome. So we'd recommend that you drive yourself if possible and avoid any public transportation or driving with anyone else in the car. Got it?
Got it.
Right. And lastly, if you do need to go to the doctor or to the emergency room or somewhere else necessary, we strongly recommend that you wear a face mask. Do you have access to a face mask, handkerchief, scarf, or something else?
Yeah, I do. My daughter made one for me.
Great. So we're nearing the end of our call today, but before I go, what questions do you have?
Honestly, I mean, nothing right now. Oh, but wait, if my boss needs to check that I'm really quarantined, who should she call?
We may be able to get you some paperwork, and I have your contact information here, so I'll see if we can arrange that.
Thanks, that would be a really big help.
Great, no worries. So to summarize, we'd like you to stay home, monitor your symptoms, and let us know if you're having any trouble sticking to our agreement. You can call me back on this number, okay?
Got it.
Great. And we'll be following up regularly and checking in on you, and we'll chat more soon.
Okay, thank you.
Great, thanks, Annette. It's been really nice chatting with you today, and I hope that you stay well.